back, my YouTube friends and family. This is Lindsay, and I am back with more daily work from home job leads for you. I know a lot of you are looking to work in the healthcare field, but you want to work from home. And I have done healthcare videos in the past, but today I have not only 9 healthcare job leads for you, but they're all non-phone job leads. And when I say non-phone, let me preface this by saying they're not call center jobs. You're not sitting on the phone taking calls from patients. There may be occasional phone work associated with these, specifically jobs that are like in the billing field. Most of the billing activities in today's world of technology is done online. You have provider portals that you can log into. You can get denial reasons from insurance companies, or if you work from the insurance companies, you process the claims electronically and give denial reasons electronically and things like that. But there are times when you're just not getting the information from the website that you need, and in those cases you might have to pick up the phone and make an outbound phone call to the insurance company to ask them for more information, or to ask them if you can have someone research it and call you back. So I'm not going to say completely non-phone, but just know it is, you make those phone calls on your own time. Say maybe after lunch I'm going to call United Healthcare, something like that. Most of the job is going to be non-phone though. I am a hiring manager in the healthcare field in a billing department, and so trust me when I say sometimes you make a lot of phone calls, some days, and then you can go weeks without even picking up the phone. So that is why I've classified these as non-phone jobs. They are definitely not call center jobs. The basis of the job is not being stuck on the telephone all day. With that being said, the links to all the pages that I share are linked directly in the YouTube description box below this video. To keep this video as short as possible, because I like to talk and ramble, I did not include the Glassdoor pages since there were so many job leads in this video for these companies. Always do your own research before giving them any of your personal information. And if you enjoy videos like this, give me that direct feedback by giving this video a thumbs up, like button. And of course, if you know anybody that would benefit from these, share with all your friends and family, because we all want to work from home, living our happiest, healthiest life. Now, first up, the first 2 job leads are actually from the same company, but they're a little bit different. So I just wanted to share. Ensemble Health Partners is hiring a senior accounts receivable specialist. Now, this is going to be remote nationwide for the United States. All of these jobs in this video that I'm sharing are for the United States. But they're basically looking for somebody to be responsible for following up directly with commercial and governmental insurance payers, resolving any claims issues in secure and timely manner. You're going to identify and analyze the denials and payment variances and act accordingly. So this means that you are going to examine that denied claim or in-process claims to determine how to get them paid by the insurance company to resolve them. You'll communicate directly with the payers to follow up on those claims, file technical appeals, resolve balance variances, and ensure timely reimbursement. So this is like a healthcare billing job. Ensemble Health bills out a claim to the insurance company, and if the insurance company doesn't send the money and pay the claim in a timely manner, you've got to find out why. Now, most of this is done online through provider portals, but again, you may have to pick up that phone and call them. Filing appeals most of the time is done electronically online these days, or through like e-fax, things like that. You're going to work with management to identify trend and address root causes of the issues of the AR and why it's not getting paid. You'll maintain an understanding of any federal and state regulations and any insurance payer specific requirements. And of course, you're going to document all the steps and activity that you do, including contact names, addresses, phone numbers, any pertinent information that you collect into the system. So as far as what they're looking for, as long as you have 4 years of healthcare experience, they're not going to require you to have a degree. They do want somebody who has a degree if you don't have the experience. So they're on the upside of whether they'll take experience over a degree or degree over experience. So no matter what camp you're in, you might be able to swing this for yourself. Above that, you've got to be able to type at least 35 words per minute, have a great problem solving skills, great critical thinking skills, and great communication skills. Now, unfortunately, Ensemble Health doesn't list their pay in their job descriptions. That'll have to be discussed at the time of the interview. Next up, same company, Ensemble Health, hiring a cash posting supervisor. Now, I always say that if you have experience in a field, why not use that experience and move up into leadership, whether it be a team lead, a supervisor, a manager, a director, whatever. That is the best place to be, is moving on up that ladder into leadership positions. But a cash posting supervisor supervises all the cash posting activities and is responsible for the performance and effectiveness of the team that is under you. So you're going to supervise all cash posting activities performed by those associates. You're going to be responsible for their payment posting remits, advice to the patient accounts, resolving any errors for payment posting guarantor payments, and reconciling cash posted. So you're going to have to help out in the cash posting activities. You're going to monitor the staff for productivity and coach them when necessary. So you're going to give them their evaluation and reviews, do things like time cards, monitor them to make sure they are working and staying on task, and you're going to provide that feedback and coach them when necessary. Of course, you'll hold monthly meetings with them. You'll collect, interpret, and communicate any performance data using various systems and tools. Now, best thing about this, no college degree is needed, just a high school diploma and GED and 3 to 5 years of job experience. So you really can move up in leadership opportunities without having to spend money going to college. Moving right along, if you like cash posting activities, but you don't want to be a supervisor and be responsible for other staff members, then Kepler Vision is hiring an RCM for a payment specialist. Now, their payment specialist is part of their revenue cycle department and is responsible for the cash posting. You'll help post and reconcile insurance payments, research payments, and do any necessary follow-up required to reconcile the payments and the bank account. So this includes daily posting, applying high volume of payments received electronically or via check into the system. You'll process any necessary adjustments with the cash posting and zero balance, zero pay remittances. You'll investigate and resolve any posting errors and support the collection efforts. So cash posting, you get the payment in and you get it posted. You're always also going to have to deal with those zero pay remittances. So it might be that an insurance company originally paid, but then took back the money on the same check. And so you're ended up with a $0 balance. Now, they are not requiring any kind of a college degree for this position, just somebody who has great grammar, spelling, and communication skills, someone who can understand EOB or explanation of benefits from the insurance company, knows how to read a HCFA form, that is the claim form that the physician's claims is billed out on. You've got to have knowledge of CPT and ICD-10 codes is what we're at now. Someone who has experience in accounts receivable and 1 to 2 years of medical or vision experience is preferred but not required. Now, they do pay anywhere from $18 an hour all the way up to $22 an hour, and they do offer a standard benefits package that's going to include paid time off and 401k. Now, Conifer Health Solutions is a company that I've shared on this channel before. They are hiring a charge audit specialist. So this is going to be a little bit different than the positions that we just talked about. They are looking for somebody to maintain and coordinate the charge description master files for the facilities. So you're going to assist with reporting and tasks directly related to that charge master. Now, generally, charge masters include things like CPT codes, different codes in them, prices that are billing out on claims, things like that. So you're going to review and maintain all the charge master databases, including activity for data entry. You'll have to coordinate with leaders and teams to assist with any special projects related to price increases, special requests from clients, system conversions, and things like that. So if every time a Band-Aid is billed out, it is supposed to drop on the claim at a certain price. And then, of course, with inflation, prices go up. So now we got to charge more for the Band-Aids. You're going to be responsible for going into the system and fixing the price in that charge router. You'll perform reconciliation of data, and you'll assist in any training or education related for new staff. Now, of course, a college degree is preferred, but it is not required. Only a high school diploma or GED is required. They do highly desire somebody who has some kind of clinical or professional certification, like an RN, a nurse, something like that. But again, that is not required. They are looking for somebody who has working knowledge of principles, practices, and tools related to accounting, finance management, or reimbursement, or somebody who has general healthcare billing experience. So you don't necessarily have to know how to run the charge router specifically. If you've had some kind of healthcare experience, you need to know how to use audit techniques and spreadsheet presentations and establish and maintain effective working relationships required by the duties of the position. They do want somebody who kind of either knows healthcare billing or HIM coding. Speaking of coding, our next job lead is from the Cleveland Clinic. They are hiring a coding quality auditor. Again, this is fully remote. Now, please let me know down in the comments below. In all of my healthcare videos that I've shared, I've not seen many people that say that they have actual coding certificates or coding qualifications. So I don't normally include a lot of coding jobs in my videos. A lot of places and a lot of states require you to actually take a coding test and pass to get a certification to be an actual licensed coder. Let me know in the comments down below if you actually have coding certifications. But for the Cleveland Clinic, this position is going to support the hospital-based coding. They're basically looking for somebody to be responsible for auditing the electronic medical records, procedural cases, and surgical cases, pre-billing before that claim goes out to the insurance company, checking the DRG, and quality audits, and making sure that everything is coded correctly. You're going to be responsible for providing feedback of the application of coding guidelines, practices, and proper documentation. You'll perform respective and concurrent audits based on coding guidelines and prepare and present reports for pre-bill and respective coding audits, excuse me. So this may require you from time to time to interact with providers and other coding staff to resolve any documentation or coding issues. So basically what this means is it doesn't matter what charges drop in the system and what the doctor said they did. If they did not document that correctly in the medical records, you can't bill for it. You have to code the claim to bill to the insurance company based on the medical records and documentation. Now, of course, no college degree is required, just preferred. They do require a high school diploma, but they are specifically looking for someone who has certifications like the American Health Information Management Association or Registered Health Information Administrator or a Certified Professional Coder, CPC, different certifications like that. Above that, they're looking for somebody who has 5 years of coding experience or 2 years of progressive on-the-job experience as a coding quality auditor. Now, coding pays very well if you do have that CPC certification. Pay is anywhere from $27.65 an hour all the way up to $42.17 an hour. If coding is not your thing, though, SCA Health is hiring an associate insurance verification representative. Again, this is remote, full-time, and pay for this position is anywhere from $18 an hour all the way up to $23.13 an hour. Now, again, a lot of insurance verification can be done online through websites and provider portals. So they're basically looking for somebody to verify the sufficient information is available for accurate verification and eligibility. This says this step may require direct contact with the physician's office or the patient. So if you can't collect all the information online and through non-phone ways for the patient's insurance and to verify that they have insurance and it's active so that you can bill it, you may have to pick up the phone and make an outbound phone call, but it is not the normal part of the job. You're going to determine if a secondary insurance should be added to the patient's account. You'll utilize the center-selected vendor for claims and eligibility in individual payer websites. That, like I said, most of this is going to be done online through websites to obtain eligibility, benefits, pre-certifications, and authorization information. You'll take that information you get from those websites and enter the patient information into the patient accounting system, ensuring the selection is appropriate for the payer and the associated financial class. So you're basically going to be verifying their insurance is active for the date of service that they're seeing and that they are covered for the services that they're being seen for. Now, as far as what they're requiring, only a high school diploma or GED and somebody who has great customer service skills. Now, that is technically it. They do prefer somebody who has some kind of AR or insurance verification experience or healthcare experience, but again, that's preferred and not required. And if you like to be on the other side of things, making sure that the doctor's information is correct instead of the patient's, then BroadPath might be for you. They're hiring a provider enrollment representative. Now, provider enrollment representatives make sure the provider's information is up to date and correct and registered with all the insurance companies. So you're going to evaluate the provider enrollment applications, including initial full applications, re-enrollment, reactivation, and change of information request. You're going to conduct in-depth review and verification of the provider data, utilizing information databases to collect this various information from organizations and agencies. You'll set up the electronic funds transfer accounts so that they can get paid for their bank accounts. You'll enter and update the provider data information and applications in the appropriate enrollment database for tracking of the applications, and you'll deliver high quality customer service and effectiveness to address inquiries from external and internal customers. So this may mean, again, you have to pick up the phone if you can't find all the information you need and call and ask somebody. They prefer somebody who has a bachelor's or associate's degree, some kind of college degree, but they will take 2 years of provider enrollment work experience over any kind of degree. If you do have a degree, though, and no direct provider enrollment experience, that's fine as long as you have 6 months of some kind of experience working in an office environment. They do want you to have great communication skills and have been worked for a Medicare administrative contractor. Moving right along, the health insurance company Humana is hiring a DRG validation auditor. Now, a DRG validation auditor confirms the appropriate diagnosis-related group assignments. You'll analyze, enter, and manipulate this database. You'll respond to or clarify internal requests for medical information, understanding the departmental and organization strategy. So you're going to perform DRG validation reviews. You'll utilize encoders and various coding resources, conducting peer reviews to ensure compliance with coding guidelines, maintaining strict patient and physician confidentiality. So this is 100% remote work from home. It says anywhere in the U.S. They are specifically looking for somebody to work Monday through Friday, 8 hours a day, 5 days a week, typically 6 a.m. to 5:30 p.m., and they're going to allow you to work in your own time zone. Now, they are specifically looking for somebody who, again, has those certifications, RHIA, RHIT, or CCS, someone who has experience with DRG auditing, or someone who has experience with acute inpatient coding. But if that is you, this is a fairly high-paying job, anywhere from $57,700 a year all the way up to $79,500 a year. $79,000 a year is going to be a little over $1,500 a week. And of course, if you've made it this far in the video, I do owe you a huge thank you. I know I can get quite rambly, but last but not least, we have Mayo Clinic. They are hiring a pre-certification and authorization rep remote. Now, make sure that you notice this says 0.75 a full-time employee. So they're not looking for an actual full-time employee, but it's not a 20-hour per week part-time either. It's in the middle. They're looking for somebody to work 30 hours per week. They did have a 40-hour per week position, but that has been filled. So they're specifically looking for somebody for their 30 hours a week, Monday through Friday, 10:30 a.m. to 5 p.m. Central Standard Time. So if you're outside of that time zone, you'll have to convert your hours to see if that works for you. They're basically looking for somebody to interact and collaborate with insurance companies, representatives, patients, and physicians to make sure that pre-certifications and authorizations are received and in place for any services that are going to be done that the patient's going to be seen for. So you're going to be responsible for resolving referral, pre-certification, or prior authorization concerns. So again, you may have to pick up the phone and call insurance companies, but a lot of pre-certification requests are done online through those provider portals. You'll tell the insurance company what the patient needs to be seen for, why they need to be seen, and upload any medical records, and the insurance company will either agree to it or not agree to it. Now, they are not requiring any kind of college degree for this position, just a high school diploma or GED and 2 years of relevant work experience. If you have no work experience, they will accept a bachelor's degree over any experience. Above that, you have to have great communication skills and knowledge of healthcare terminology like CPT and ICD-10 codes. Now, this position pays very well. Mayo Clinic is known for paying very well. Pay is anywhere from $20.45 an hour all the way up to $31.98 an hour. All right, if you've made it to the end of this video, I want to say thank you, thank you, thank you so much for watching and supporting me. As always, please feel free to leave in the comments anything specific that you're looking for. I do read those and keep that in mind. Let me know in the healthcare field if you enjoy the non-phone billing administrative cash posting type work, or you don't mind customer service in the healthcare field. But don't forget, if you enjoyed these job leads, give me that direct feedback. Give this video a thumbs up, a like button, share with all your friends and family, and I'll be back really soon with more work from home job leads just for you.